being the last line before the medication actually gets into the hands of patients, that could be make or break for that specific patient.
My name is Humberto. I'm a clinical assistant professor at a school of pharmacy. I've been in practice for 23 years.
I'm Michael. I am an inpatient pharmacist working with a hospital chain in New Jersey.
My name is Sindhu. I am a new grad PharmD, so just graduated in May. Currently, I am doing postdoctoral training through a fellowship.
My day normally starts at the hospital on average around 7 o'clock. It's first ensuring that the control medications are stocked for the entire hospital. It could be a process that takes 30 minutes to an hour, and it's something where you want to be meticulous. The last thing you want is like the DEA knocking at your door saying like, that your numbers are off.
One day a week, I'm giving a lecture on campus, maybe half a day spent at the clinic. While I'm at the clinic, I'm reviewing patient charts, touching base with the providers, seeing if they need anything, working with insurance companies, with pharmacies, taking calls, sending authorizations to get the patient's medications approved.
During my actual 9 to 5, right now I'm focused on medical content and training, so providing training for new data that's coming out from clinical trials to medical science liaisons and other members of the healthcare community, so we can raise awareness of the different treatment options that are out there.
What's the biggest obstacle a lot of times is interpersonal skills. So one of the hardest things to do, where a lot of times we have to meet the patients in the arenas they are, but also coworkers, employees. I think also growth mindset, because the field is changing, and if you don't change with the field, you're gonna be left behind.
With any healthcare profession, there's continuing education. You have to be really willing to keep on learning and keep on being adaptable to new medications that are coming out. As a new grad pharmacist, there is a lot more emphasis on technology and being able to integrate that into our work, and also being detail oriented, especially with medications. Being the last line before the medication actually gets into the hands of patients, that could be make or break for that specific patient. And I think having that perspective of you are impacting people at the end of the day is really important.
Whatever the skill set, put a language in your back pocket. If you want a patient to tell you anything, just drop a welcome in their home language. They'll tell you everything.
Ensure that it's not just about a disease state and a medication, that you see past that and you see how that's really impacting the person. Pharmacy programs are usually post-undergrad or graduate level. There are some that are hybrid that could be accelerated undergrad, graduate combined.
So you have different programs that are popping up that are dual degrees. So you just have to make sure you do your research and see what options are out there.
You are done with your PharmD degree, you apply to take 2 licensure exams, right? So your law exam for the specific state you want to practice in, and then the NAPLEX, and you are required to pass both of those after a certain amount of practice hours, usually in your 4th year of pharmacy school, in order to become a registered pharmacist and be able to work in patient care settings.
Your interview process starts the moment you start your clinical experience. So every time you go into a hospital, a retail chain, a big pharma company, you're actively interviewing.
Treating interviews as conversations is really important, because I know when I first started interviewing for internships, I was very, very robotic. And I think that is a really acquired skill that comes with a lot of practice. We should be relying on our mentors, our preceptors, to be okay, do you mind just running through how I could explain my experiences with you so you can give me feedback and I can, actually showcase the impact I've made.
Your mentor's gonna give you the best critique. They're probably gonna shred you. Yeah. You're probably gonna feel like the worst of the worst, but what better place for it to happen when it's a test run, it's not the actual thing. Your mentors are always gonna help you create the CV, talk about the job that you want, and just use your soundboard.
Usually pharmacy residents and fellows make a little less, and then after you're done with your postdoctoral training, at least for fellowship, it can really vary.
As a clinical specialist, you'll get paid more as a clinical specialist, anything from 110 to 160, 170,000, depending on the specialty. As a faculty member, you're getting paid less.
An inpatient, I think it's roughly around the same. You're looking at anywhere between 120 to about 150, 160, and it's normally based on the amount of years worked and also the chain that you're with.
A lot of clinical pharmacists end up going into industry and working within the clinical trials, medical affairs, drug info, marketing even. So I know many examples of folks that hopefully our roles will continue to allow for some of that growth.
We cover every single disease state you could think of. So at any point in time, the phone rings, you pick it up, and you have to speak to neuro, heart, kidney, lung, infectious disease, and it's like, oh, go. I feel like I have the baddest swagger around at times.
As someone who loves research and loves science, being able to work really closely with data really excites me on my day-to-day basis. I feel like I'm not doing the same thing over and over. I feel like every week and every day looks really different for me.
Pharmacy is an evolving field that you can make what you want it to. So take the leap. Check out more job insights right here on Indeed's channel.